welcome back in 8:14 this morning. Dr. Yana Korstismukes is here along with our regular guest, Dr. Jerome Williams. Good morning.
Good morning.
Good to see both of you. In our vet segment today, we're talking about eye surgery and eye problems for our pets. And who do you have here today?
This is Sibby. She is my Cavalier King Charles rescue.
She's so pretty.
Thank you.
Oh, she's a sweetheart.
So lovable.
Yeah, she is. Look at her. So she was a rescue?
Yes,
Oh, wow.
yes.
All right, so let's talk about what are most typical problems with pets or dogs in their eyes?
Well, it's quite a variety, but similar to on the human side, we see quite a few cataracts. 85% of our diabetic patients will develop vision impairing cataracts within the first year. Eyelid abnormalities, allergic diseases and immune mediated diseases, corneal diseases, primarily in dogs, but I see all species.
All right, you sent us some pictures that we're going to look at. We're going to pull these up here and tell us what we're looking at.
So that's a little poodle that has diabetes.
Aw,
and that's
sweetheart.
her before cataract surgery. You can see she has
Very cloudy,
very cloudy. And that's her directly, or probably a couple days after cataract surgery, where the cataracts have been removed. She has artificial lens implants in both eyes.
Oh, wow.
And she can see again.
So is it similar to humans? Or it just sounds a lot more difficult, though.
It's similar in that the procedure is exactly the same. It's called phacoemulsification. Diabetic cataracts in dogs are rapidly progressive and very quickly blinding. So that's a little bit worse than in people.
So, Dr. Williams, can you tell right away when someone brings their pet in for some kind of a test or something, or checkup? You can tell?
You can see that milky, cloudy appearance of the eye when you look back in the eye. Jill is getting that. We'll show it the next time we're on. At 15, 16 years old, it's one of those things that occurs with age. And, you know, it's one of those things that we'll send to Dr. Korsh in due time.
Now, Dr. Korsh, can it turn into something else if it's not corrected?
Yes, that's a really good question. So even if owners elect not to pursue cataract surgery, the cataracts can cause inflammation, can be very uncomfortable for the dog, and it can lead to secondary glaucoma, which is increased pressure inside the eye.
So keep an eye on your pet's eyes, have them checked regularly.
Right.
And Dr. Williams was here, the last time he was here, we talked about tumors and different things that are found in our dogs, and many of you have been asking about Buddy. We use Buddy as an example. Our golden retriever. There's Buddy chilling by the pool this weekend, feeling a whole lot better.
All right, great.
But he was struggling on Friday when he had surgery. Didn't want to wake up from the anesthesia too well, but tell us kind of what you saw there.
Well, Buddy had a lipoma, a fat tumor that we had diagnosed by doing a biopsy earlier, and we went and removed it on Friday. And as you said, he was a little slow recovering from the anesthesia, but he's a trooper, a real trooper.
He did really, really well. So thank you all for asking about him as well. And I took a picture of the tumor. I wasn't going to show it on TV. I didn't want to gross you out completely, but it was pretty gross. All right, so I guess the lesson learned today, keep an eye on our pets' eyes and have those checked regularly.
And Dr. Korsh does so many different species as well, besides just dogs, cats,
Not just dogs.
horses, you name it. She does all
Zoo
the
animals, yeah,
All
whatever.
right, a little bit of everything. Thank you both.
Okay.
Thank you, sweetheart.
And she's at Riverview. At
Yes, at
Riverview
Riverview
Clinic.
Animal Clinic.
Okay, thank you
Good-
both so much.
Good morning, Elin and Sloan.
There you go. All right. Where are we going now? I'm sorry. Let's go.